This lesson will center around Healthy People 2020. So this will relate to the course objective, how Healthy People 2020 goals and interventions can be implemented in the local community setting, and also the weekly learning outcomes, being able to define the Healthy People initiative, discuss one health issue or goal in each age group defined by Healthy People 2020, explaining the role of the healthcare professional in health promotion and achieving Healthy People 2020 goals, and to be able to identify future trends in healthcare. So what is Healthy People? So it was published by the United States Department of Health and Human Services and is what they say is an evidence-based 10-year report card, where you're looking at health accomplishments within the United States from the years, because it started in 2000, from 2000 to 2010, and then we're in currently the 2010 to 2020 era, and now we're looking at formulating the leading health indicators moving through the year 2030. So it looks at different behaviors, what they call leading health indicators, which we will look at, and sets goals, and then sees what's happened within that 10-year time span, and then sets goals for the next 10 years. So it focuses on the larger social picture that surrounds healthcare outcomes and takes into account social issues, global health issues, emergency preparedness. Those things are being included now in the Healthy People 2020, which is a good thing. And then for the current 10-year period, for the leading health indicators, they are looking at access to healthcare. So how are people able to access healthcare? How do they get to the doctor? Do they use telehealth? Do they have access to health insurance? Those types of things. Do they have access to the services that they really need? Can they get a mammogram, for example, something like that? Clinical preventive services, which would be health promotion and disease prevention, for screening, like a mammogram, again, is another example of that. Looking also at environmental quality. What's it like, is there smog? What's the temperature, the weather like? Are there a lot of factories nearby? Looking at injury and violence and suicide, different aspects of maternal, infant, child health, mental health, oral health, looking at reproductive and sexual health, as well as nutrition, physical activity, and obesity. Social determinants, which has to do with the indicator they have right now, has to do with high school students graduating within 4 years of starting high school. And then also looking at substance abuse and tobacco use. So those are the 12 leading health indicators. The link should take us to the Healthy People webpage, which I will put up there for you. You will have this available to you in the course, and so you can look and see that these are the leading health indicators on this site over here. And when you go, for example, to access health services, it will take you to the overall view. So the indicators for access to health services are number of people, persons with medical insurance, and persons with a usual primary care provider. So in other words, those people that have a primary care provider that they see on a regularly scheduled basis. So let's take a look at that one, persons with a usual primary care provider. And the AHS is access to health services. So what you are looking at is increase in proportion of persons with health insurance. And then this is increase the proportion of persons with a usual primary care provider, which is the one that we're looking at. And so the baseline in 2007 was that 76.3% of people had a usual primary care provider. So the target that they're looking at by 2020 is that 83.9% of people will have a usual primary care provider. And so they're looking for a 10% improvement. And these are the sources that they're using for that information. And so these are different places that they can, where they get the data to see exactly what % of people have a usual primary care provider. And then there are these other ones are ones that they have done in previous years that they're no longer tracking. So that gives you that information. And then what we do in our local communities is find ways to look at access to healthcare or having a primary care provider, and what are ways that we as healthcare providers can promote that for people. So one of the other factors that comes into play is something called determinants of health. And so this has to do with other factors besides the individual, besides us, that, that are at play in trying to access quality healthcare. And so you have different social, economic, environmental factors, and it has to do with your individual behavior as well as some biological and or genetic factors. So if you are looking at the slide here, if you look into, let me do this, let me draw this for you here. If you have the individual here that you start with, and the individual has with them their biology, right? And they have also the behaviors that they have as a result of that biology, and that is the individual person. And then if you look at what affects the individual person, you'll see that the socioeconomic environment, so, you know, their job, where they live, resources that are available to them, and then also their physical environment, what type of home or apartment, do they have food, do they have clothing, do they have shelter, Maslow's hierarchy of needs. So depending on that information, that is going to affect whether or not they have access to the quality health care, as well as what policies and interventions that, like Medicare, Medicaid, private insurance, different ways that we are able to access healthcare. So those are things that are called determinants of health that help us to be able to and or not be able to access healthcare. So we get rid of those and then keep moving on here. So for, let me get rid of those. For biology and behavior, the factors that come into that, that's your genetic makeup, the family history, any health problems, and then as behaviors, like how you respond to things, your reactions to internal stimuli, external conditions, what's going on around you. And biology and behavior are interrelated. Disease can affect biology, but behaviors can make a person susceptible or resistant to a disease. And then also the social and physical environments impact behavior. So the way a person chooses to eat, the way they choose to exercise or not exercise, or to smoke or not to smoke, or do drugs or not do drugs, those things affect the biology and can make them susceptible, as well as the environment. If they are in an environment where many other people are not eating healthy, or where there are not places available to eat healthy, then that affects people's health. So again, talking about the environment, the physical environment, social environment, we just touched on that. And then talking about different policies and interventions. So what policies keep us safe? What, like for example, seatbelts. There didn't used to be a seatbelt law or a car seat law, and people died as a result of that. And so those laws were put into effect, and lives are saved every year because people were wearing their seatbelt, or the child was in a car seat appropriately buckled according to age and height and those types of things. Also disease prevention services. So that would be an example of that would be immunizations, immunization clinics. So those prevent diseases. And so you were supposed to go get your immunizations to help with that. And then different health promotion campaigns. So one that would come to mind would be the Back to Sleep campaign. We used to put our babies to sleep on their tummies all the time, and then it was found that that could potentially lead to death from SIDS. And so there's a Back to Sleep campaign to where you put the baby to sleep on their back and not have anything in the crib, and maybe just one blanket, no pillows, that type of thing. So those are different policies and interventions that can also affect health. So when we're looking at access to quality healthcare, so think about how accessible is healthcare to various groups of people. So think about children or people with visual impairments or hearing impairments, or people of color or transgender people. How accessible is healthcare, the healthcare that those particular populations need, how accessible is it to them in the community where they live? And I don't have answers. These are questions for you to think about that perhaps you may not have thought about. And then to also think, would greater governmental control over certain aspects of health be beneficial or detrimental, so helpful or not helpful, in helping with healthy lifestyles? So would you prefer that government have control over that and tell you, that you can't drink alcohol, or you can't smoke tobacco, or denying healthcare to people who are persistent in unhealthy lifestyles? So you have what we call the frequent flyers in the emergency room who come in, or the drug seekers. So should they not receive healthcare? Those are some of the big questions that we deal with on a constant basis when providing healthcare. When you look at health status, you can measure health status of an area of people by looking at birth and death rates, life expectancy, which is how long the person would live, morbidity from specific diseases. So morbidity is the illness, not that somebody's died, that would be mortality, but morbidity, do people have a lot of heart disease or a lot of cancer? Looking again at access and looking at health insurance coverage. So in the communities, in our local communities, we are supposed to be developing or have developed plans to help achieve and maintain healthy behaviors and lifestyles. So we have those in this community, but how accessible are they to certain people, and what is the data that shows where we stand in the Salinas Valley, in Monterey County, Santa Cruz County, those types of things. So this slide is a slide of the 10 leading causes of death by age group in the United States. This is the most recent statistic I could find, which was from 2016. So you can never really get real-time statistics. It's usually a couple years behind. And what we can see here is that for the age group, less than 1, and this is causes of death, so this is mortality, that congenital anomalies, children that are born with a congenital anomaly, anencephaly, where they don't have part of their brain, or a congenital heart defect, that's the greatest cause of death. And then in blue, they have listed unintentional injury. So we can see that from age 1 through 4, 5 through 9, all the way up to 44, that the leading cause of death in that age group is unintentional injury. You can also see patterns here where the number 2 ranking cause of death, when you look in this adolescent young adult group in green, suicide. And then if you look at the 3rd cause, again in the adolescent young adult group, homicide. So that's why injury and violence is one of the leading health indicators. And then interestingly, homicide in the 1 to 14-year-old category. So child abuse, shaken baby, shootings, that type of thing. And then as you get older, you notice that malignant neoplasms, so that would be cancers, and then heart disease, heart disease, chronic lower respiratory disease, so COPD, diabetes here is a 5th leading cause, Alzheimer's, stroke. So this just gives you an idea of the different types of disease processes that are going on. So if we could provide programs to help people not get to that point, then that would be very helpful. When you talk about life expectancy, so we're looking at, have we made any progress and what goals do we still need to accomplish? So life expectancy, which would be the average number of years that the person born in a given year is expected to live. So depending on what year you were born, you are expected to live till X number of years. It doesn't change. Just because you were born in 1965 and you were expected to live till 76 doesn't mean that now in 2020 you're going to live till 84. You're still expected to live to 76 because you were born in 1965. However, I personally believe that you still reap benefits of that. So hopefully that's true, that people will live longer. So you can see the trend here that in 1990, the average life expectancy was 75 years. And that by 2017, the average life expectancy is 78 years. And that's an average for men and women in this particular statistic, because depending on the source that you look for the information, you will find differing information. And then if you look at where do you think the United States falls in that? Because we're pretty good with our health. There is a list from Worldometers that has life expectancy rates. The CIA has one, the World Health Organization has one, many different sources have one. But for this particular one, there's 191 countries that are on that list. And my question to you before I pull it up to you is, where do you think the US ranks in life expectancy when compared to other countries in the world? So what do you think the top 3 countries are, the countries where the people live the longest, or potentially the bottom 3 countries, the people with the shortest lifespan? So think about that for a moment while I pull up the website here, and I will show you how they have categorized the data. And so this, again, we're talking about world population. So men and women average 73.2 years is the average life expectancy for people born in 2020. So here we're going to look at the countries ranked by life expectancy. And remember, I asked you what you thought the top 3 countries would be. Let's just even go to the top 10. There we go. So the country with the longest life expectancy right now is Hong Kong. And the average life expectancy is 85 years. And then you have Japan with 85 years, Macau with 84, Switzerland is 84, and so on. Italy, Spain, Australia is 83. They have some really good health programs in Australia. And then we continue down. I don't know if any of these are surprising, but I still haven't seen the United States. And I will tell you, there's Canada, average age of 82. We know we're around 78 years, because that's what the previous slide told us, right? There's Ireland, New Zealand, Greece, Luxembourg, Portugal, Finland, Belgium's in at number 25. Guess we have to keep going. Germany, United Kingdom, Denmark, Taiwan, Costa Rica. Some friends that moved to Costa Rica. They're really enjoying it. It's a very nice lifestyle down there. Puerto Rico, average life expectancy of 80 years. French Guiana, Maldives, Czech Republic, Barbados, Curacao, Poland, Lebanon, Cuba. There we are. Number 46 in the world with an average life expectancy, according to this particular source, of 79.11 years, where the women's average life expectancy is 81.6 and the male is 76.6. So we're 46th in the world. Why is that? There is really not an answer necessarily for that, but it's just a really good talking point, I think, where certainly I would have thought we would have been higher up on the list. And so let's continue to look down. We'll go all the way down, because the other question that you were asked was, what do you think the bottom 3 countries are? And so let's scroll down here. So the Central African Republic, Chad, which is also in Africa, Lesotho, Nigeria, Sierra Leone, Somalia, those are all in Africa. In fact, it looks like all those countries. And the average life expectancy is 55 years old. So I just wanted to put that out there. So how can we, what do we do as healthcare providers? How can we help people in our country, in the world, to live longer? Again, the many factors play into that, but so let's look and see. What we're going to look now is looking at healthy people and looking at the different age groups. So if we're looking at prenatal care, maternal child health, we'll look at adolescents, and we'll kind of look through the developmental stages. So having maternal infant health, that's where it begins, because the woman gets pregnant and then you have more babies and your population increases. And so what you look at is, in determining health status, is the decreasing infant mortality rate. So you want to hopefully have less children dying before 1 year old. So infant mortality is defined as the number of deaths occurring before 1 year old out of 1,000 births. And so we've been making progress with the Back to Sleep campaign that I talked to you about earlier, and also promoting folic acid supplements for women to decrease the congenital deformities such as spina bifida, the neural spinal cord injuries. So that's a good thing. And then if you look at childhood health, wanting to improve health literacy and improving the quality, availability, and effectiveness of the programs. So the programs that we have, how do we get the information to the children, to the parents? And so you have to look at, well, should we add this to the school curriculum? The teachers should know about this. Should this be something that they should be teaching children, the school nurses? What about parents? Do parents have a responsibility in being able to do this? School nurses are not, there's not one school nurse per school anymore. There was a time when that was a thing. And now oftentimes it's 1 or 2 school nurses per district. So a lot of times the secretary or some volunteers are the ones coming in providing health services to the children. So we want to make sure that they are, that they're educated, or we need to look at perhaps other ways of having, increasing the school nurse population. So one of the questions to think about would be, how can school nurses continue to provide quality health education and screening programs when one nurse is responsible for several schools? So that's what I would ask you to think about. Are there some creative ways that you could think of to where you can provide quality health education using the school nurse, not using the volunteer or the secretary, that type of thing? It really makes you think, because a lot of times it comes down to money or having enough school nurses available to staff the schools. So we're going to move on to adolescent and young adult health, where we want to reduce the death rate and increase the health education. When we looked at the death rates, a lot of the second leading cause, first was unintentional injury and second was suicide. So you want to look at the injuries, violence, suicides, tobacco and drug use, unintentional pregnancy, sexually transmitted diseases, unhealthy diet and lifestyle. Because what the picture's kind of showing you, here's a young lady who's gotten her driver's license, and the odds are that she's going to be texting while she's driving, or potentially drinking while she's driving, or partying, or being distracted while she's driving. And so that's why they have this highway safety program, so that young drivers can hopefully understand the consequences of the choices that they make. So if we could have community programs that spoke to that, or school programs that spoke to that, where you have peers together learning about it, that might make a difference. And then looking at older adult health, as people get older, they tend to lose their independence. They start to rely more heavily on other people, whether or not they want to. They generally need to. And so hopefully if you can, as a healthcare professional, help them manage their chronic diseases, get them access to health services, train the people that are taking care of them, how to take care of them, then those are really good things. A lot of the, not necessarily long-term care facilities, but they do the elder care homes, have, you know, physical activities that go on daily, a couple of times a day, they go on outings, those types of things. But it's really difficult, I think, to have individualized care or meet, you know, somebody's individual need of what they would like to do. For example, if the person wanted to go shopping, they want to go to Target. Well, the only way they can do that is by the bus that takes them there. And generally the trips to Target are only on Tuesdays. So if the person on Tuesday isn't able to go, then they don't get to go to Target to get their vitamins. Say they wanted to go pick up their vitamins. So we have to figure those things out and figure out ways to get them what the services, medications that they need. So the geriatric adult, the old elderly person. So one of the things, we often think of vaccines for children, but there are vaccines available for adults. Shingles, flu, the annual flu, pneumonia is another one. And so if we could promote vaccine health for the elderly, that would help. A lot of those deaths, according to the list that we saw, were neoplasms and heart disease, but the pneumonia, the respiratory health issues were, I think, 4th or 5th. So that would certainly help. Reducing the number of hip fractures. So that would be unintentional injury for falls, people that would have subsequent frequent falls. And then being able to diagnose dementia cases to understand if people truly have dementia or Alzheimer's, what their mental capacity is, because that eventually can help with safety and health as well. Remembering to take their medications, remembering to push the call light before they need to move so that they don't have as many falling accidents. So then another thing for you to think about would be trying to remain independent as you age, right? How can nurses and other healthcare workers ensure that the population can continue to care for itself? So how can you as a healthcare professional promote independence as a person ages? You know, is it that they're totally independent? Is it that they have, you know, caregivers that help them? Is it setting them up with certain things, you know, their toothbrush, their toothpaste, a washcloth to remind them to brush their teeth and wash their face? I don't know. Again, it's a question for you to think about. Hopefully these are things you haven't really thought about. And so this is giving you something to think about. So what is our role as healthcare workers, healthcare professionals in helping to achieve Healthy People 2020 goals? So these are different examples, increasing the use of prenatal services, promoting breastfeeding. You know, those are things that we can do. We can encourage people to do that. We can remind people to do that. We can step in and talk about nutrition and exercise and drug use in the schools. We can also, I think, which is a really good thing, promote health through employer-sponsored programs. There's a lot of employers now that have their own on-site gyms or offer memberships to gyms, membership discounts to different gyms. And so those are things that we can ask for. We can ask that companies provide that or suggest that our patients look to see if their companies provide something like that. What we can do, again, we can also help with identifying health risks through the screening programs, encouraging people to go to the screening programs, the blood pressure checks, mammograms, sometimes they'll check blood sugars, you know, organizing or encouraging adults. I love this picture. It's the elder adults in looks like a gym, and they have their walkers and those are chairs, and they're trying to do their exercises, which I think is great. And there's men and women. They all have smiles on their faces. So I think that's wonderful. So encouraging people to, elderly people, all people, but elderly people as well to take part in that. So there's another thing that's going on, not really related to Healthy People 2020, but you may have heard of it. It's come actually to Monterey County, to Salinas, and it's called the Blue Zones Project. And I will put some links up in the course lesson pointing you towards Blue Zones itself and Blue Zones specifically for Monterey County. And one of the things that Blue Zones has done is they have recognized that there are certain populations throughout the world who have a greater life expectancy than others. People are living a lot longer in these particular communities, and they did some research and they found that people that lived by what they call the Power 9 tend to live longer because they're applying these principles to how they live. And so the Blue Zones Project is trying to create one or more of these Power 9 in communities to help people live healthier, longer lives. And so what you'll see here are downshift, so decreasing your stress, purpose, so making sure that you wake up and you have a purpose, there's a reason to live. And then plant slant, so less meat, more veggies. Wine at 5, a glass of wine with good friends each day, 1 glass, probably red. Family first, investing time with family and add up to 6 years to your life. The 80% rule, eat mindfully and stop when you're 80% full. Move naturally, find ways to move however you can. The right tribe, which is surrounding yourself with people who support positive behaviors that are uplifting, that lift you up. And then belonging to a faith-based community, attending services can also add years to your lifespan. So some of these things are things that you can do yourself, but several of them are family and community type of things to do. So what they found is that in some of the communities, like the community, they all have wine at 5, or they all, there's farmers markets everywhere to get fresh produce, that they spend a lot of time with their families, or that they're always walking or biking or have some activity that they're doing in the community. So I think that's a good thing to think about as well. So that's a wrap for this lesson. Here's some key points for you to remember. You should be able to define Healthy People 2020 goals and leading health indicators. You should have be able to explain the life expectancy trends that we went over in the graph, and then be able to describe at least one leading health indicator per developmental stage. So per stage, what are we looking to help with to promote in that developmental stage? So again, if you have any questions, please feel free to use the community question and answer discussion, and I will do my best to answer those questions. And otherwise, I will talk to you later. Thank you so much.